Hi. The Labour government, under the auspices of the National Health Service, have been running a pilot scheme of community health and wellbeing workers, CHEWIs. Thereby, dwellings are targeted in a designated area to check the well-being of locals in deprived areas, to monitor and offer assistance, knocking on doors, arranging help with medical appointments, debt, unemployment and such like. On paper, this sounds positive. I've lots of people lack help dealing with the physical and mental health problems and find it difficult to negotiate through a complicated Kafkaesque system. Many also exist in isolation, loneliness, poverty, with no one to turn to. Therefore, any form of a helping hand would appear to be welcome and provide a degree of reassurance. But we live in a society where a knock on the door could bring dread and trepidation, with the fear of predators who thrive in this alienating environment, product of broken communities where many live in semi-isolation, constricted by lack of money and an uncaring, increasingly brutalised society. If anything positive arises from this, if implemented on a larger scale, it should be welcome. But something artificially created by a growing in all directions authoritarian state, a new layer of bureaucracy, governments that simply cannot be trusted on any level, anything they embark upon is bound to raise the most justifiable suspicion, with the CHEWIs regarded as snooping agents of the state, whose purpose is to report to the authorities, attempt to coerce the long-term sick and unemployed into exploitative, meaningless employment, maybe winkle them out of social housing in favour of what the government and their supporters consider to be more deserving tenants. From previous experience, historical and accumulated knowledge of these employed in the lower levels of the state, it's far from irrational to be suspicious of state hirelings. The stated aim of this scheme, rather than the well-being of the poorer sections of society, is to save hundreds of millions of pounds in the long term for the National Health Service, whereas the true result could be to release hordes of mini-Starmers to spy upon, control and dominate. Be suspicious, very suspicious. They could be after your benefits, living spaces and possibly more. For example, have you ever considered assisted dying? Bye.